We plan to use the community healthcare providers to combat social stigma with mental health and extend psychological support where possible. It remains critical to update the training and competence of the community health workforce. I want to mention that there are some points going forward. I mentioned the following 5 priorities for the community clinic. First, to make community clinics serve as gatekeeper at the grassroots to prevent huge out-of-pocket payments for health services. Second, to enable community clinics to provide enhanced digital health and diagnostic services, especially for NCDs. Third, to further develop the capacity of community clinics to address growing climate-induced health crises like dengue outbreaks. Fourth, to improve screening and treatment facilities for mental health and neurological disorders so as to provide accessible services to those affected and their families. And fifth, to use community clinics as the primary building blocks for a robust data-driven health and nutrition program. We are convinced that community-based primary health care is key to achieving universal health coverage. As an emerging voice of the global south, Bangladesh would champion this issue as a possible avenue for meaningful international partnership. We call upon our development partners, including multilateral financing institutions, to extend their support for the cause of community-centric health services in the developing world. On our part, Bangladesh stands ready to share our insights and expertise with those interested.
I thank the
public health milestones in a short period of time. One outstanding example, universally accepted, is that primary healthcare is a cornerstone of to future health emergencies. As we embark on this journey, let us recall the profound St. Martin, Her Excellency Silveria Jacobs, Honourable Ministers and Deputy Ministers, Excellencies, ladies and gentlemen, Assalamu alaikum and very good morning to you all. Firstly, I would like to commend Her Excellency Sheikh Hasina for leading the charge in putting primary health care in limelight. And also, it's an honor to be here among such strong female leadership. Today, we are gathered here on the sideline of the
coverage for all. Any one person left behind leaves us all open and all vulnerable. Thank you.
I thank the Honorable Prime Minister.
To future health emergencies. And last, build international support and partnerships for scaling up mental health care initiatives and disability responsive interventions within community-based and lessons learned from community-based primary health care models worldwide, such as what was just presented to us. Discuss resource and technical services. COVID-19, as we were just about to bounce back from that in early 2020, 3 years later, only exacerbated this role in determining mental health outcomes at the personal and family level when mental health is getting the type of attention it deserves and the stigmas being removed. I must say more and more people are making use of it. However, we are currently in the process where the government covers those persons. So working families and working persons and their families. And so I am happy to say that we do have a good level of healthcare insurances like social insurance and all employed pay into the system. We are a small island developing state, much smaller than I was just discussing with my colleague, some of the islands in the Maldives. Just 37 square miles. For the forward movement of your country in the area of healthcare. It is quite inspiring to see how far Bangladesh has come, and I am proud to sit next to you as a female leader today. Today, on the sidelines of the 78th session of the UN General Assembly, we are gathered here to discuss and explore the transformative power of innovative approaches which we have
initiative has been highlighted as the Sheikh Hasina Initiative Vaccination Target. The government is now working to achieve sustainable using the rate of China, antenatal care and postnatal care, reproductive
medical center at every union and a hospital at every third quarter.
The dream of the father of the nation is being successfully implemented by her daughter, the Honorable Prime Minister Sheikh Hasina. For the underprivileged and marginalized rural people of Bangladesh, the government has already established 14,275 community clinics in the country on the lands donated by the local people. Community Clinic of Bangladesh is now the largest public-private partnership in rural healthcare initiative in the world. The biggest success of Community Clinic is it makes rural people concerned to think about what to accomplish for their healthcare needs. For engagement of different organizations, institutions and individuals alongside government and extension of healthcare services at the doorsteps of the people with its sustainability. In October 2018, Community Clinic Health Support Trust Law has been passed by the National Parliament.
All for your patience hearing. Jai Bangla, Jai Bangabandhu, Assalamu alaikum. The Sheikh Hasina initiative, that is community clinics, will be increased to 73 years from 65 years in last 1 year, reducing child and mother mortality rates by providing nutritional support and right treatment facility. It saves life, money and time. Here early, which will reduce the need for hospital admission. Additionally, it helps including maternal and newborn care, reproductive health, family care assistant twice a week, trained community health worker, birth training, conducted 16,000 over normal deliveries. Total referral was over 1.7 million per clinic. Around 2.2 million pregnant women and around 500,000 mothers received, and in 2022 over 110 million visits to increase engagement with locals. Community clinic is the lowest tier primary healthcare facility providing 20% coverage. The community clinic is a great illustration of public or community-based primary healthcare services delivered through community clinics. Community clinics are an inclusive and participatory method for providing. Currently, there are 14,275 community clinics. I would especially like to express my gratitude to the United Nations Assembly and the participating wellness and those that address prevention, treatment, rehabilitation, and palliative care for all ages, honorable ministers, dignitaries, and dear participants. Welcome you all, the Honorable Chair, Her Excellency Sheikh Hasina, Honorable Prime Minister of the People's Republic of.
Building on that, we need to put a force in strengthening the community-based primary health system over the last decade. The Sheikh Hasina initiative in Bangladesh has been acknowledged by the General Assembly this year as an exemplary, able and visionary leadership of Honorable Prime Minister Sheikh Hasina, launched a unique and innovative community-based UHC. We had high-level meetings on UHC aiming to move the coverage as a receiving due attention at the highest political level, which is one of the targets of the Assembly is holding 3 high-level meetings on pandemic preparedness and responses. I also wish to thank all the high-level representatives for sincere appreciation to the co-organizers of today's event, Antigua and Barbuda, achieving universal health coverage inclusive of mental health and disability. Ladies and gentlemen, good morning. I, Muhammad Abdul Muhi, Ambassador and Permanent Representative of Bangladesh to the Universal. Do I have mic, please?